If you lift weights, there's a 1 in 3 chance you'll hurt yourself for life. And much of that risk comes down to 3 common exercises you need to stop doing. The one that causes the most issues, the upright row. You grab those dumbbells and pull straight up towards your chin, feeling that burn in your shoulders and traps. Seems standard, right? Wrong. What you likely don't feel is the internal collision happening inside your shoulder joint with every single rep. Think about repeatedly slamming a car door shut on delicate wires running through the hinge. That's like the action inside your shoulder during an upright row. You're forcing the top of your upper arm bone upwards, crashing against the bony roof of your shoulder. Pinched right between them are the sensitive tendons and cushioning sacs that allow smooth movement. Every rep pinches, crushes, and grinds those soft tissues. At first, maybe just irritation, then tiny fraying. Eventually, a painful tear or a chronic condition where those tissues are constantly getting pinched. Why is this so bad? Your shoulder can move amazingly well, but that freedom means it isn't as tightly locked as in other joints, making it easy to injure. Shoulder problems are notoriously common for lifters, stopping progress dead in its tracks. And once you seriously damage those inner tissues, like tearing your rotator cuff, getting back to normal is a nightmare. Forget quick fixes. Expect long, painful rehab. Maybe even surgery with difficult recoveries where many people never get back to 100% pain-free movement. Countless athlete careers have been cut short by shoulder injuries caused by this kind of internal grinding. So looking at that weight, ask yourself, is chasing that pump really worth gambling on your shoulder's future? Every upright row is potentially carving away at those delicate inner parts, bringing you closer to damage you can't undo. And this is just the first exercise to worry about. So how do you build strong, wide shoulders without wrecking the joint? Ditch the upright row and do this instead. Do the dumbbell lateral raises. Stand tall, holding a dumbbell in each hand at your sides. Keep a slight bend in your elbows. Lift the weights out to shoulder height. Pause briefly, then lower under control. This movement targets your middle deltoids, the same muscle you sought with upright rows without forcing your shoulder into that bad position. Focus on slow, controlled reps and maintain tension through the entire arc to build shape and strength safely. If you think this is bad, the next one's even worse because it seems harmless, yet it quietly destroys your shoulders and elbows from the inside out. I'm talking about bench dips. Bench dips look innocent. You see them everywhere as simple body weight moves for triceps. But hidden in that simplicity is a movement pattern that can wreck your shoulder joints. Imagine forcing a door hinge way past its stopping point, stretching it further than it's meant to go, and then putting heavy weight on it. That's like what you're doing to the front of your shoulder with bench dips. You lock your hands behind you and lower your body, forcing your upper arm bone far back, way beyond its comfortable range. This dangerously stretches the tissues holding the front of your shoulder together. Then, in that super stretched, vulnerable position, you load it with your body weight, rep after rep. With each dip, you're putting immense grinding stress on the front of the shoulder joint, straining the tendons, like your bicep tendons, where they attach. This isn't just stretching. It's accumulating tiny amounts of damage over time that can lead to chronic pain, making the front of your shoulder feel loose and unstable, or even causing sudden, painful tears in your chest or arm muscles near the shoulder. Forget feeling a deep stretch. You're pushing vital tissues toward their breaking point. Think again about recovering from major shoulder damage. It's often incomplete and life-altering. People have suffered horrifying, sudden injuries doing dips because the joint is placed under maximum stress in its weakest possible position. Is getting a bit more triceps work really worth potentially crippling your shoulders permanently? Before placing your hands on that bench, weigh the temporary pump against the risk of lasting damage. Want to target those triceps safely and effectively? Drop the dips and master this powerful variation, the closed grip push-ups. Position your hands shoulder width apart directly under your chest on the floor. Keep your elbows tucked close to your sides as you lower your body in a straight line until your chest nearly touches your fist. Then press back up. Now, if you think bench dips are dangerous, the last exercise on this list is probably one you're doing right now, and it might already be quietly stressing your shoulders and ribcage. I'm talking about the dumbbell pullover. You lie perpendicular on the bench or even flat on the floor. Grip a heavy dumbbell with both hands and lower it slowly behind your head. You feel that stretch across your chest and lats. Feels powerful, right? In reality, every single rep is like bending your shoulder into a rusty hinge and then slamming your lower back against a vise. Here's what's happening inside you. As the weight drops behind your head, your shoulder joint is forced into extreme extension beyond its safe range. The front of your shoulder capsule and the delicate ligaments there are stretched thin, like an overstretched rubber band. At the same time, your chest muscles pull tight against that weight, yanking your spine into an arch. With each press back up, your lower vertebrae compress against one another under massive load. You won't feel a problem today, maybe not tomorrow, but every micro tear in those ligaments and every crushed disc layer stacks up. Before long, you'll wake up with a deep ache behind your shoulder or a pinching pain in your low back. That's the silent warning of torn tissue and bulging discs. Doctors report cases of chronic impingement, tendon degeneration, and early stage herniations in clients who swear by pullover routines. Spine specialists will tell you spinal discs rarely heal once they're bulged, and shoulder tendon tears often require surgery, with recovery that never truly restores your old strength or mobility. Ask yourself, is that chest and lat stretch worth risking permanent damage? Every pullover rep is gambling on your body's weakest links, your shoulder's front capsule and your lumbar disc. Instead, master the single arm dumbbell row. Place one knee and the same side hand on a bench or sturdy chair. Hold a dumbbell in your free hand, keep your back flat and core braced. Pull the dumbbell straight up to your hip. Think, elbow to ceiling, then lower slowly. This move trains your lats, traps, and rear shoulder without forcing your joint into dangerous extension or loading your spine in an arch. Your torso stays neutral, your shoulder blade retracts safely, and your core stabilizes every rep. Perfect your form here and you build the same pulling power and muscle thickness without the hidden risk of torn ligaments or crushed discs. You learn the truth. The exercises you thought were safe are silently destroying your body. But knowing this isn't enough. You need to take action. Cut these exercises from your routine today and replace them with safer alternatives. Your future health and fitness depend on it. Click on the next video on the screen for smarter exercise choice that build your strength without injury. And make sure to subscribe for more fitness tips that protect your body for life. Stay strong.